Good afternoon, everyone. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. I know all of you have been waiting patiently to hear about the state's granting of waivers to school to open in the fall. Our hardworking healthcare agency is ready to assist school administrators in their process to open safely once they receive these waivers. We are still waiting for an update from the governor and will keep you informed as soon as we get any information. The Orange County Healthcare Agency will be launching the COVID School Response Team, which is a unit of public nurses and physicians who are dedicated to providing guidance to administrative staff at schools that have been exposed to COVID-19 or are seeking general guidance. This team can answer general questions about COVID-19, provide information about testing locations, education about self-quarantine, and conduct case investigations and contact tracing activities. Next, I want to share with you that yesterday I visited 3 police departments to show support for law enforcement in these tough times. In the face of radical calls for defunding or dismantling our local law enforcement, I introduced a resolution to the Board of Supervisors in support of our men and women that protect our communities by creating a Law Enforcement Appreciation Day, which will be held on August 11th. This was approved unanimously by the Board of Supervisors 2 weeks ago. Throughout the day, I visited the Buena Park, Los Alamitos, and Seal Beach Police Departments and presented to each of them the Law Enforcement Appreciation Day resolution signed by all 5 supervisors. Our law enforcement officers were blessed to have the support of our local businesses, providing them with either food or sponsorship for their commitment to protecting the community. These businesses include Wahoo Fish Tacos, Subway Sandwiches, Madera's Steakhouse, and Pacific Urology. In the coming weeks, I will be presenting copies of our Law Enforcement Appreciation Day resolution to each of my district's 10 city police departments, as well as Orange County Sheriff's Department. Our local law enforcement are on the front lines every single day, protecting our families, patrolling our streets, risking their lives for our safety. We saw that this week was several members of the Huntington Beach Police Department contracted COVID-19. At least one may have contracted it while struggling with a criminal suspect. It's a stark reminder of what these men and women do for us each and every day, and important for us to remind them that they have our overwhelming support as much as we have theirs. Next, I have some great news for our first responders. All at our Anaheim Convention Center super site, we will be providing priority testing for our brave first responders here in Orange County. Law enforcement, fire, and EMTs will be eligible upon pre-registering. If you are a first responder and are interested in testing, remember to bring an ID. There will be a dedicated lane just for our first responders. Making sure they have quick access to COVID-19 testing is vital during this crisis, and this priority testing at the Anaheim Convention Center is a commitment to our first responders. We are so grateful for the sacrifices that these men and women make every day for our communities, especially during this crisis. Next, I want to address a number of questions to Dr. Chow on Tuesday at the Board of Supervisors meeting. I asked why the state had frozen hospitalizations data and further questioned if the HCA has been separating individuals that had come to hospitals solely for COVID-19 or had been added to the positive totals after coming in for a different medical reason. We want to work closely with our hospitals on this issue, and I look forward to getting more transparent answers on this. I also asked why the state's reporting methods were making it so difficult for our HCA to obtain, access, and deliver COVID-19 reporting data to the public in a timely manner. We know how hard our staff at the HCA are working to fight this virus and protect our most vulnerable communities. I applaud Dr. Chow and his team for their hard work in this area, and I look forward to getting more clarity on these matters. In closing, I want to continue to remind the residents and visitors of Orange County to please wear a face covering when you are in a public place and unable to properly social distance, as well as follow hygiene and social distancing guidance. Compliance with this guidance will help us get out of this crisis faster. We must also remember that as we protect public health by social distancing and wearing a mask, we need to allow people to go to work safely and responsibly so they can pay their bills and feed their families. Today, I am joined by Dr. Clayton Chow, Director of the Orange County Healthcare Agency, and the Acting County Health Officer, who will provide an update on the county's COVID-19 numbers, as well as county's response and mitigation efforts to this outbreak. And Dr. Chow.
Thank you, Chairwoman Steele. Good afternoon, everyone. My name is Dr. Clayton Chow. I'm the Orange County Healthcare Agency Director and the Acting County Health Officer. I would like to start by providing an update on the cases reported to us today. Today, our accumulated case count will increase by 503 cases to 35,778 individuals confirmed with COVID-19. 17 deaths will be reported, 3 from skilled nursing facility residents, 1 from assisted living facility resident, and 13 individual non-facility. The cumulative total of deaths is 604. Again, our heart goes out to the family that have lost a loved one to COVID-19. There have been intermittent issues with CalReady, the state system, causing a delay in reporting tests, and as of yesterday, the state system experienced an issue with duplicate test reports, which resulted in a higher number of cumulative tests to date on the website. Adjusting for these duplicate test reports, today's cumulative tests to date will be 1,337 fewer. Additionally, hospital data reporting continues to be a challenge as the state has not updated all of the hospital capacity data since July 22nd. For this important indicators, we will calculate the percentage change in hospitalizations, percent of ICU beds, and percent of ventilator available with available local data while the California Department of Public Health resolves the issue. While the state challenge is out of our hands at the county level, we want to remind folks that what you have control of is helping us to slow the spread of this virus in our community. Practice physical distancing, wear a face covering, and wash your hands frequently. Please, you can learn more at ochealthinfo.com/slow the spread. Now I'm pleased to announce the Orange County Healthcare Agency's new advertising and community outreach campaign to encourage Orange County residents to be vigilant in helping to slow the spread of COVID-19 by protecting themselves and others. This campaign takes a stop, drop, and roll approach to help people remember the basics: face, hands, and feet, featuring simple steps: wear a face covering, wash hands often, and stay 6 feet apart. The key message focuses on simple actions we can all take to care for ourselves and one another, specifically focusing on harder to reach communities and people of whom English is not their first language. The Face, Hands, and Feet campaign will use outdoor boards, transit shelters, and digital and social advertising. Additionally, an intensive community outreach plan includes a partnership with Latino Health Access to employ the Promotora model to reach those in the Hispanic and Latinx communities, the hardest hit populations in Orange County. In addition to Hispanic Latinx outreach, the campaign will focus efforts on Black and African American community, as well as Vietnamese, Filipino, and Asian Pacific Islanders. Community outreach toolkits will be available in English, Spanish, Vietnamese, Chinese, and Tagalog. Additionally, flyers and videos are available in multiple languages at ochealthinfo.com/protect each other. Thank you. Now I'm going to ask County CEO Mr. Frank Kim to come to the podium.
Good afternoon. My name is Frank Kim. I'm the County Executive Officer. Now we'll pause and see if there's questions from members of the media. Moderator, our first question, please.
Our first question will come from the line of Spencer Custodio with Voice of OC. Your line is open.
Hi, thanks for taking our questions. I believe this one is for Dr. Chow. On the county's dashboard, when it shows the deaths, the cumulative number of deaths, it goes by, which day the deaths have happened. Meanwhile, the state dashboard that shows deaths goes by days unreported. So, for instance, Monday it was reported, just to pull a number, 15 deaths. So the state dashboard will show that, and their dashboard shows, the last time I checked, about 135 new deaths over the past 2 weeks. But the counties, when you look at the counties doing the math on the county's dashboard, it shows something different, about half that. I was wondering if there's concerns that, the two different dashboards might paint two different pictures for residents. We're getting a lot of emails, a lot of confused people are trying to decipher, kind of what's going on. And is there any plans to do two sets of graphs, one showing the day that the people have died and another showing, the day these cases?
Sorry, you cut off, but I think I get the gist of your question. Thank you. So if you notice on our dashboard, on the side, on the left panel, we do show the number of deaths received per day. But then when you look at the graph, we go back to the day where the death actually occurred. We think that that's the most accurate data to help us look at trend. Because if you just show the day where you don't really figure it out when the death actually occurred, you will never able to understand the trend. So that's our effort. Thank you.
The line of John Earl with Surf City Voice. Your line is open.
Yes, thank you. And my question is for Michelle Steele, if she's still there. Is she available?
Yes,
And,
Chairwoman Steele is available. Your question,
okay.
please.
Okay, my question is regarding, I don't know if she or Mr. Kim, if you visited, for example, the downtown Huntington Beach area lately, but there's no better place to show the lack of compliance with the mask order, social distancing orders and guidelines and so on. It's just rampant and obvious to the eye in passing. One major hotel down there has had 3 COVID cases among employees in less than a month's time. And given that the surge of COVID and the deaths that have occurred since Dr. Quick's departure, I wanted to ask the chairperson, or I can ask you, would it have been more prudent now in hindsight to have accepted her order on the masks and the science that was very evident at that time? And when will the county have a real and effective enforcement program coupled with its educational efforts, which so far apparently have been very lacking in effect? Thank you.
Okay, the first question regarding Huntington Beach Main Street, that we are working very closely, our healthcare agencies, working very closely with city management team. So Dr. Chow can answer much better than that, better than me, because they've been always communicating with 34 cities. And second question is, could you repeat that? You have about like 2-3 questions here, so.
Yeah, I'm sorry. I
about
I don't know if you heard me right.
Okay.
I'm having a hard time hearing you. But when will the county have an effective enforcement program with regards to the social distancing and mask order?
You know what? That's a sheriff's department that, what sheriff's been talking about, that how he's going to work with. That I heard that city has their own police department and they're working together. I heard that, what happened last weekend in city of Huntington Beach. So that's what police departments and sheriff can answer that. And then I remember now for the second question regarding the face masks, I was never against. We strongly recommend to wear masks, but there's no enforcement by the sheriff or other police department. We say we don't have to make the law, but make people to wear their face masks when they are, they cannot have social distancing. That's what we've been talking about. I was never against the face masks, that you have to do it. That's what we've been talking about every press release at this time. So I'm going to ask Dr. Chow to come up and talk about that, how he's working, our healthcare agencies working with each cities, that, how we relay the messages.
Thank you, Chairwoman, and thank you for the questions. Mr. Frank Kim and I have a phone call with the city manager and the city mayor separately once a week. And on every single phone call, both of us encourage the elected official as well as the management team to support us by educating and constantly encourage their local resident to follow the face covering requirement, as well as the physical distancing and the hygiene. I know I worked very closely with the Huntington Beach city manager and his team as recent as last week to deal with event that gathering there. And I can confidently say that they are very supportive of the order, and how do we reinforce that is the question of enforcement. But the best we could do is actually go out and educate the community and really show data, encourage folks to follow the order from the state, from the county, from the city, and then use education as a way to encourage folks to do that. From the reporting in some of the incident, it sounds like the education piece at least work. And of course, we can't deny the fact that in certain instances, when it doesn't work, and so there are steps taking together with not only the local city law enforcement, but we also work with state strike team, as you heard, with entity like how OSHA, with an entity like the Alcohol and Beverage Control Unit. We keep close contact. We just had a contact with the Board of cosmetology earlier this morning, so we had a really good conversation on how do we support each other to really send information out to our community, to our really mutual clients, to encourage people to follow orders, follow guidance. So thank you.
Line of Paul Anderson with City News Service. Your line is open.
Hello. Can someone explain what difference it makes whether somebody went into the hospital for COVID or another reason and then found out they were COVID positive? It would seem to me even if they were asymptomatic, they're still spreaders, and I don't understand why a breakdown of those numbers makes any difference.
Well, I think from a county perspective, and particularly for my board members and for our executive team who are working on policy issues, it's important for us to have a good census of the individuals that are in our hospitals and understanding the needs of each of these clients at a broader community level. Because what we're trying to understand is how many of the individuals in our hospitals are there primarily for a COVID reason and are filling an ICU bed, versus how many of the individuals are coming in for an alternate reason but are being hospitalized perhaps for a different medical condition, and just coincidentally they have COVID. Because for us, the county is always looking at our overall hospital capacity and our bed availability and how many of the beds are filled, and it really helps us to understand in terms of the progression of the disease and the number of infected individuals within our community. Are we doing a better job, and are we improving in the method of treating those individuals with COVID? So as our positivity rate and the number of people infected by COVID rise, are we seeing a corresponding rise within our ICU beds or overall hospital beds? And in order to have a very good view of that, we need to try to distill out those that are in for primarily a COVID reason versus those that are in for other hospitalization reasons, but they just seem to have COVID. So that information is helpful in terms of how we allocate it could be for a funding purpose, also for our messaging, and also our close coordination with our hospital partners. So there's quite a bit that goes into it, but I think always having access to that kind of information is helpful for my board as it is for our staff. Next question, please.
Next, we'll go to the line of John Underwood with LATV3. Your line is open.
Yes, my question is for CEO Frank Kim. My question is somewhat related to a previous question that asked about enforcement. And I'd like to know a little more specifically if those jurisdictions under county control, the healthcare agency, the sheriff's department, are actually actively enforcing any of the restrictions, requirements imposed by the state and or the county guidelines currently now. Are there enforcement infractions, misdemeanors, violations on the books now? Is anyone out there representing the county actually enforcing and writing citations for restaurants that are out of compliance, nail salons that are out of compliance, tattoo parlors, wine tasting rooms, etc.? I know we're not citing for masks around the county at the moment, but for other violations, are there enforcement? Is there enforcement on the books now? Infractions that have been issued.
I think if you're asking about whether we have written any written citations or things of that nature, I would ask Dr. Chow to respond to that, since the environmental health team reports under his management. But what I would share with you is that I've absolutely encouraged and supported not only the sheriff but also our healthcare staff in ensuring that if we have restaurants that are, let's say, as a hypothetical, if they're engaged in allowing in-restaurant dining outside of compliance with the state guidelines, absolutely. Our staff are contacting the state strike team, and we're having those conversations, and we're taking action. But obviously, in our county, as is the case in most other counties, the first contact is always for education. Did you know what the state guidelines are? Did you know that you're out of compliance? You're out of compliance with this particular aspect. And I think that's part of the reason why our board 2 weeks ago had authorized and directed my office to work with a third-party entity to develop a COVID-safe restaurant incentive program. So from our county perspective, absolutely that there is a balance between enforcement and incentives to encourage the appropriate behavior. But I can absolutely assure you that if there are restaurants, cosmetology businesses that are out of compliance, we will absolutely come and take a visit, and we'll take the appropriate action. If there's any additional comments, Dr. Chow is saying that he agrees with those statements. So that is our position. We will take action. Thank you. Next question, please.
And next, we'll open the line of Ian Wheeler with Orange County Register. Your line is open.
Thank you. Dr. Chow, you touched on a bit of weirdness in the data earlier in this call, but it seems that the reporting of what appear to be artificially low case rates has continued over the past week. For example, today, Orange County is at 150 cases per 100,000 residents. And last week, you said that also stood out to you, and that you didn't have an answer yet on whether these drastically lower rates were caused by a data entry backlog at the state level. So three questions. What has your office learned about this problem over the past week as it pertains to lower case rates? And are case rates still actually higher, like in the mid-200s range that they were a couple of weeks ago? And when will accurate case rates be shown on the county's tracking site going forward?
So thank you so much for that question. We have constant conversation with the state, not only on the statewide call, but also with the individual who is assigned state monitoring liaison for Orange County about this issue. And we were assured that the state worked very hard in trying to mitigate the solution, the problem. As you point out, currently we are at 150 over 100,000, which is down from 221 just last week. We don't know if the number will show up more. We predict that we'll probably have a large number once the state fixed their system. But you're right. I think earlier I mentioned that even today we went in and we took out 1,337 cases because the system gave us cases that were duplicate report that had been in our system, so we have to go out and scrub them out, so we're not duplicating the number. So it is an issue that the state recognized that is occurring for all county, not just Orange County, and I know that the state working very hard to try and mitigate that. Thank you for your question, Ian.
Moderator, do we have additional questions from the media?
We do, and next we'll go to the line of Matthew Leslie with Fullerton Observer. Your line is open.
Hi, thank you for taking questions today. I think some readers and listeners may find it ironic that the Board of Supervisors have voted unanimously to honor law enforcement agencies at a time when most of them are refusing to cite anyone for not wearing masks. At what point does it become at what point will the Board of Supervisors kind of look at the situation along with the health director and say that we've hit a point where unless people are wearing masks, we're not going to stop the spread of the disease socially? And I wonder if Board of Supervisors Chair Michelle Steele is there to answer this question. Which departments did she visit, and are any of those departments requiring or enforcing the mask rule with the issuing of citations?
You know, so I can't answer that question on the behalf of the sheriff. The sheriff is a countywide elected official, but what I can share with you is that in my discussions with police chiefs and with city managers, I think we all recognize that encouraging appropriate behavior is a part of appropriate enforcement. And it's not the most effective tool to come out and cite every individual that you see that is out of compliance with a particular face mask order. I think education, encouragement, engagement, and I think that's what you're seeing from the county, is that we've really stepped up our communication from a public outreach perspective. We've created incentive programs, and at the same time, as I mentioned earlier, we are actively engaged in partnering with the state strike team where we see out of compliance behavior. So that is the balancing act. I don't think that our intent is to go out and really hammer every individual that we see on the street that may be out for an afternoon hike. They may be out to run essential errands. There are many different conditions where individuals may not be required to wear a mask, whether they have a medical condition or other particular individual reasons. So from a county perspective, I think it's always the case that we want to engage the individual, we want to have that dialogue, we want to share information, we want to strongly recommend that they follow these guidelines, and then if there is a repeated pattern of behavior, or we see restaurants or businesses that are actively discouraging the adherence to a statewide order, then we absolutely will act. And we think that that is the appropriate way for us to manage this within our community. Next
Mr.
question,
Kim, may
please.
I ask just quickly, do you think it's working, that approach?
I absolutely believe that the adherence to face coverings has been improved markedly over the last several weeks. I understood that you had comments about a particular beach community. I can share with you that I was out along the Pacific Coast Highway and did visit, and I did see, at least anecdotally, that significantly improved adherence, and I see that in my own community where I live. So I think that Orange County residents are doing a fantastic job, and they're certainly improving in terms of adherence to the mask policy.
And just lastly, I mean, what are you basing that on? Just anecdotal information that you're seeing an improvement?
No, I think we have conversations almost daily with my healthcare team that are out visiting restaurants, and while they primarily work on citing for restaurant health and safety violations, they also provide rich feedback in terms of what they're seeing in terms of their observance and adherence to state policies. And then we have discussions regularly about the out-of-compliance behavior that we see, and then the actions that we're going to take in terms of working with our state strike teams and monitoring agencies. So those discussions happen regularly. Thank you for that question. Next question, please.
And next, we'll open the line of Dr. Jessica Sanova with ABC7. Your line is open.
Thanks so much. I'm not a doctor, though. I'm a reporter with ABC7. Thank you all for your time for answering these questions. So, kind of going with the, the honoring our law enforcement, the day that we are, I think you said August 10th. I wanted some clarification on that date to honor our law enforcement. And my question is, right now we're seeing a call from the Black Lives Matter movement to defund law enforcement and put more funding into addressing mental health issues and how to combat mental illness in our communities in using another approach other than law enforcement, more training in that department, more resources going toward that. How are we addressing those calls from our community members?
I don't think that those two issues are mutually exclusive. So I think our board absolutely recognizes the importance of law enforcement. It is one of the core foundations that we as a county are locally responsible for providing, whether it's our jail system, probation officers, our district attorneys. Those are all law enforcement partners that are core to keeping our community safe and creating the rich environment that we have for economic prosperity that I think Orange County has done an outstanding job in over the years. If the question really is about how can we reinforce that incredible investment that we've made in our strong law enforcement structure with additional training, with discussion with community members about how to address their individual concerns, While I can't speak for the sheriff, I can speak for our probation office and for other law enforcement partners where we do have a role under the board's leadership and the CEO direction, and we're absolutely open to that. And I know that that dialogue and the discussions with community partners has existed and certainly has intensified over the last several months. So I just don't see those two issues as being exclusive. And our board, I'm certain that they have passed resolutions supporting the recognition of all the challenges that came up over the last several months, that we see those as being two components of a very important public safety structure of addressing community concerns while also addressing adequate law enforcement within our communities. Next question, please.
And next, we'll open the line of Nick Gerda with Voice of OC. Your line is open.
Hi, everyone. Thanks again for taking questions. I wanted to go back to the death by date chart on the county website that Spencer was talking about. That chart has been showing a big drop in deaths over the last few days, which seems to be the case no matter what day you're looking at the chart. Whether you're looking at the chart a month ago, the prior days are always a big drop, which then goes up as those reports come in because of the delays from death reporting. So what I wanted to know is if the way the county is currently showing those deaths by date creates an appearance of drops in deaths that may not actually have happened yet because those deaths haven't yet been reported into the system. And I was curious why there's not a label on the chart making it clear that some deaths in recent days might be missing until later because of the delays in reporting, and whether it's misleading without that label.
Thank you, Nick, for that question. If I remember correctly, there's a tab on the FAQ, and there's an explanation on the death case, Nick. I'm going to go back and take a look at it, and if it's not there, we'll add it. So contact us later, and then we'll get that information to you. Thanks, Nick.
Sure. And Dr. Cho, could you speak to whether that is a dynamic where there typically are deaths that are missing for the recent days until they're reported later?
Yes, we know that per standard, a death case need to be reported within 8 days. And so I think if anything, there's always an 8 days delay. Now, with that said, there has been cases that was reported out to 14 days or so. But on the average, it's about an 8-day delay. Thanks, Nick.
Okay.
Next question, please.
Yes, sir. Next, we'll go to the line of John Underwood of LATV3. Your line is open.
Yes, this question is for CEO Frank Kim. Just a follow-up, if I may, with regard to an earlier question about enforcement and citations. I wanted to know, you emphasize, of course, education as a primary motivator for people to do the right thing. But under this situation of citation, does the county and or its healthcare agency release information regarding citations as if, every day, restaurant closures for, a lack of hot water or cockroach infestation? I mean, does it do the same thing? Does it do the same kind of transparent reporting out for repeat offenders with regard to the county's and the state's guidelines for population protection from COVID?
Thank you for that question. So in terms of how we report data, I think we really, what's the right way to answer that? I think the way that we manage that is we have certain responsibilities that the state has delegated to my environmental health officers. They operate under state guidance and state regulation in terms of what they are permitted to regulate. And that generally is within the area of food safety. So that's hot water, that's temperature, cleanliness, and those types of things. So within that authority that we have, as we have violations, we do make that information available publicly. I think the question is, if a restaurant or a business is operating outside of a state order related to COVID, then the question is, what is our role in that? And we've had those discussions not only with our healthcare director, but also with our county council, and that is outside of the direct authority of my licensed state environmental health inspectors. So when it comes to those state items, we absolutely recognize that we're in a restaurant and we are observant. So where we see out of compliance behavior, it's not to say the fact that we turn a blind eye to it. We absolutely are going to engage and inform the restaurant about the state guidance. We will provide them a copy of the state order. And if we see non-compliance, we absolutely will share that information not only with local law enforcement, but also with the state strike team. So that is how we're managing it. We don't see that as the primary role of our environmental health inspectors, because that is not what their training and what their duties and core responsibilities are. Next question, please.
Next, we'll open the line of Norberto Santana with the Voice of OC. Your line is open.
Yeah, everybody, thanks for taking questions. I guess Frank or Dr. Chow, you can take this. I'm just curious, a couple of questions. How many county workers are already back at work, like they're at the office and back, and how many have gotten sick? Do we have any numbers at that of how you've transitioned people back, or are you transitioning them back? And again, agency by agency, how many people have contracted COVID or gotten sick because of it as they're coming back? Just an interesting way for your own experiment to see how that's working. And secondarily, my other question is just in terms of the healthcare agency, it seems to be in a period of huge challenges where you have massive turnover. Dr. Chow, you're pretty new there yourself. Lily Simmering, who used to give the updates at the board, I think has moved on. I think there's a new deputy agency director for public health services, Dr. Margaret Redenhoff. So I'd just like to ask you guys, how are you grappling with this massive challenge in front of you in terms of like what you were talking about, Frank, with the HCA in terms of restaurant inspections? I'm curious, how many pamphlets have you given out? How many people have you talked to? How many restaurants have you visited? Is there any way you can give us a sense if the policy is heavy towards education, how good of a job is HCA doing on that education? I mean, we're 4 months into it. We still have problems with reporting basic case counts and death rates, and your own board chair is asking about hospitalization rates again and again. It seems like on all the basic numbers, 4 months into it, amidst huge staff turnover, you're kind of frankly not doing that well on that front. In fact, your best outreach is Latino Health Access to use the contract tracers in the community. So I'm curious, how are you guys dealing with this massive challenge in front of you, acknowledging that it's a huge challenge?
Well, thank you for those questions. I think you've asked quite a handful of questions. So let me try to parse those out, and then I'll see if Dr. Chow has any additional input if I don't get to all of them. So I think you would ask, what is the percentage of employees that are currently telecommuting? It's approximately 40%. When we went into stage 2 and the governor started to allow some additional industries to open, I started to reopen county government, and we opened up our customer service center, and I started to phase in additional employees back from telecommuting. But then when we had the pause and the state started retracting and curtailing some of the openings, the county paused as well. And I have not brought back any additional employees, and in fact, the discussions I've had with my department heads have been about ensuring that as we reopen with the rise in infections, that we're managing the health and welfare of our employees as well as from all the clients who would have in-person visits. In fact, we've heard quite a bit from our clients that they would prefer to interact with us via phone, internet, or other mechanisms instead of the in-person. So actually it's worked out well for both clients and for county staff that we have reduced the number of in-persons. We have found innovative ways to engage our clients in alternate ways to complete that work. I think we've got some fantastic examples. I know our clerk recorder stood up a pop-up booth at the Honda Center and was performing marriage ceremonies. I know that at our social services agency, we've asked for volunteers, and we do pre-screenings outside in the open air before we allow people to come in. We have put up plexiglass. We've distributed personal care kits. Obviously, we are managing the welfare of our employees as a high priority, so when we have employees that are infected with COVID. Obviously, we're coming in right away. We're doing contact tracing. We are cleaning our offices. We are making testing available to all those individuals that had high risk or prolonged contact with the positive employee. You had asked how many of our employees have COVID. Well, it's like any other illness. If I have the flu and I'm out, I'm not necessarily required to report that on a particular chain. I have to inform my supervisor that I'm not well and I'm not coming into the office. So I don't have a perfect count of that, Noberto. What I can share with you is that I am aware that we've had at least 200 employees that are COVID positive. That is from kind of self-reporting, and we do keep data, but it's not a requirement that every employee that have contracted COVID report that they are COVID positive. So the best number I can give you is the estimate based on self-reporting, and it's approximately 200. I don't know if I captured all of those questions. I think you had asked a general question about how we're doing with the struggles of managing during a crisis. And what I can share with you is that we're doing as well as any other county of our size, in that it is difficult. I can't look you in the eye and tell you that it has been an easy road. All of the staff that I have that are in the critical response programs, such as healthcare or social services or within my community services or in law enforcement, they've all been working 7 days a week, absolutely push right to the limit. And it's very difficult for them because it's hard to take time off. It's hard to take a mental health break, and I do worry significantly about our employees. It absolutely has resulted in high turnover, and that's a challenge for us. But in terms of the reporting, I know that absolutely that we had made a mistake in terms of posting the serology information, but outside of that, I completely disagree with your assessment that we have not provided good information to the public. I think that we absolutely have. In fact, we are here at these press conferences answering your questions. We provide regular updates at each of our board meetings. Our board has kept all of our board meetings open to the public, which I know that many large counties have refrained from. We have done our best to be open and engage members of the media as well as members of the public, and I'm quite proud of the work that Dr. Chow has done along with his team to ensure that we're always transparent and that absolutely in a crisis nothing is going to go perfect, and we have instances where we do make mistakes, and where we've absolutely admitted to them. I can recall several press conferences where we've talked about things that have not gone the way that we had hoped for within our operations, and as well as sharing with you all the wonderful things that are happening, such as expanding testing, such as the work that we're doing with Latino Health Access, as well as all of the data points that Dr. Chow is engaged in. Today, as you can imagine, there's quite a bit of conversation happening with school districts, school boards. We've put up additional information on our website about school-age kids within different geographic areas and case counts, et cetera, to provide additional information to the public, to members of the public that have children, for school districts, so that they can engage, get information, and make good decisions about how they're going to manage as we begin the discussion about how we reopen schools. So at the same time, we're fighting this battle across many fronts, and we're absolutely proud of the work that we've done, and we always seek to do a better job. So I appreciate your questions, and I don't know if Dr. Chow has any updates.
Thank you, Noberto, for that questions. And I think what I like to do is to add to what CEO Kim have just told you. And I think you asked the question about staffing. Clearly, staffing is a huge issue nationwide, as well as California and for all the county, because we short of staff. I'm talking about medical staff, particularly for the county public health staff. People have now reached COVID fatigue. You probably heard the media talk about that. I don't believe that there's any public health department in this state that fully staff. I know for the position that require public health nursing, I'll tell you, public health staff are a hot commodity. And so before I came, I'm replacing the previous health agency director. And before I came, we lost our deputy director for public health, and we couldn't fill the deputy health officer, which is the health officer assistant, Dr. Nicole Quick's assistant. And then Dr. Quick resigned, as you know, in June. But I'm happy to inform you that we filled the Deputy Agency Director for Public Health, Dr. Margaret Brederhoff. She's coming in on August 10th. We're very excited. If you heard me report to the Board of Supervisors on Tuesday, I'm pleasantly surprised that we got 9 candidates for health officer position, replacing Dr. Nicole Quick, and we have top 5 candidates that are very outstanding, and we're moving forward for the board to interview those 5. As you know, Dr. Nicole Quick's position, the health officer position, is the board appoint positions, and then we have 15, I remember, don't quote me on the exact number, but we have somewhere around 15 doctor who interested in the deputy health officer. I'm waiting for the health officer to come, and then he or she and I will together fill the deputy health officer position. So in that respect, I think that we're really, really good. I know my colleague across the county, other county are jealous of the number of applicants we have for Orange County. So, but again, the shortage is public health nursing. So if you know any public health nurses out there, please refer them to us. We're always hiring public health nurses. Thank you.
And we do have a follow-up question from the line of Spencer Custodio with Voice of OC. Your
Thank
line
you.
is open.
And I think we had time for, this is our last question. Go ahead, Spencer.
Hi, thanks for taking the last question. This one is for Dr. Chow. There's been a lot of talk and concerns over, people going into hospitals for another procedure, say a knee replacement or a hip replacement, so what they call an elective procedure. And when they get there, they might test positive for COVID, and now they're counted in as a, COVID hospitalized patient. But the board of Cal Optima, Dr. Paul Yost, who also works at St. Joe's Hospital, told me, that's just simply not the case nearly every time, because when the patient comes in, they're given a COVID test before they're admitted to the hospital, unless they're there for something like a heart attack or something, life-saving procedure like that, or they're there because of COVID symptoms. But say if I went in for a knee surgery and I have to get my COVID test first and I test positive, they're going to turn me away and not even admit me to the hospital. So, Dr. Chow, do you have any kind of ballpark estimates on how many people this has happened to, say going for a knee surgery and all of a sudden they test positive for COVID and they're hospitalized as a COVID patient, or are they turned away? Do we have any idea what the numbers are? Are they big? Is it a very minuscule number?
Right. So that's a great question, and that conversation is now statewide, and those of us who are health officer also have had conversation with the state. As you are aware, nationwide there's a change in hospital reporting system. The hospital used to report directly to CDC, and on the 21st of this month, that has changed to reporting to the Human and Health Services. And with that, there's a change in the form that the hospital fill out. It is actually quite extensive now, and that's the reason for the delay, because the state has to pull information from that system and post on their system, and then we go in there and pull them out. I know from talking to most of my colleagues in the hospital system, if you go in for a procedure, most hospital, I'm going to say most hospital, will test you for COVID. because they want to make sure that they place you in the appropriate section of the hospital that just for people who have COVID, right? And so to the extent of how many of those people, we don't know, and I'm hoping that we are working together with our local hospital to see if we could get them to report or give us that information, as well as suggesting to the state that perhaps the state would need to pull out separating out people who's hospitalized with COVID versus people hospitalized because of COVID. So I'm also anxious to find out what that number is. And once we get it, obviously we will share with all of you. So thanks for that question.
Well, thank you everyone for participating today. That concludes our press conference for this week.